When you eat, food passes from your mouth into your esophagus, a muscular tube that leads to your stomach. Your esophagus has a ring of muscle at the end, called the lower esophageal sphincter. It opens to let food into your stomach. Normally, it stays closed to prevent stomach contents from going back up into your esophagus. If the sphincter doesn't close all the way, gastroesophageal reflux, or GERD, can happen. The weak or relaxed sphincter allows the contents of your stomach to reflux, or leak back into your esophagus. Acid in the stomach contents irritates your esophagus. This can cause a painful, burning feeling in your chest, called heartburn, or acid indigestion. It's common to have gastroesophageal reflux once in a while. However, if it happens more than twice a week for a few weeks, you may have a more serious condition called gastroesophageal reflux disease, also known as GERD. If left untreated, GERD can lead to complications over time. For example, you may develop esophagitis, where the lining of your esophagus becomes inflamed or irritated. Your esophagus may become too narrow, which is a condition called esophageal stricture. GERD may cause you to breathe stomach acid into your lungs. This can lead to respiratory problems such as asthma, chest congestion, hoarseness, wheezing, laryngitis, and pneumonia. GERD can also lead to a condition called Barrett's esophagus. In this condition, the cells lining your lower esophagus are replaced with cells similar to those in your intestine. This may increase your risk for developing cancer in your esophagus. Common causes of GERD include being pregnant or overweight, which puts pressure on your abdomen, smoking, certain medications, such as those that treat allergies, high blood pressure, and depression, and a hiatal hernia. A hiatal hernia is a condition where the upper part of your stomach moves up through an opening in your diaphragm. This makes it easier for stomach acid to come up into your esophagus. The most common symptom of GERD is heartburn. Other symptoms include nausea, problems swallowing, bad breath, hoarseness, sore throat, and bringing food back up, called regurgitation. Treatment options for GERD include lifestyle changes, medications, and surgical procedures. Making lifestyle changes can help you control GERD, such as losing weight if you are overweight, eating smaller meals, avoiding certain foods and drinks such as coffee, alcohol, chocolate, and fatty or greasy foods, staying upright for 3 hours after meals, avoiding eating 2 to 3 hours before going to bed, wearing loose-fitting clothes around your waist to avoid squeezing your stomach, which can push acid up into your esophagus, and quitting smoking if you smoke. There are several types of medications that can help control your symptoms. Antacids help relieve heartburn by neutralizing the stomach acid that causes it. H2 blockers and proton pump inhibitors relieve symptoms by reducing the amount of acid produced in your stomach. Proton pump inhibitors, or PPIs, also help heal damage to your esophagus caused by reflux. Prokinetics can help your stomach empty faster so that its contents don't back up into your esophagus. You may need a combination of these medicines to control your symptoms. If lifestyle changes and medication aren't working, or if you have a hiatal hernia, your healthcare provider may advise a surgical procedure called fundoplication. During the procedure, if you have a hiatal hernia, your surgeon will move your stomach back to its proper place. Then your surgeon may tighten the opening in your diaphragm with stitches to prevent your stomach from bulging up through it. Next, the upper part of your stomach will be wrapped around your lower esophagus. It will be held there with stitches. This helps prevent stomach contents from leaking back into your esophagus.